Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Hello friends, what are the side effects of theophylline? Theophylline overdose. Theophylline overdose will mainly cause, it causes seizures and fatal arrhythmias. It causes seizures and fatal arrhythmias. It can also cause shock. It can worsen the CBS status. It can increase the muscle tone. Extrasystoles will occur. But these are most important. Okay. Thank you for watching. 1 minute. I will write all the side effects. It would be better. Agitation can occur. Then sometimes tachypnea, vomitings, palpitations, diuresis will occur. Then dyspepsia, headache will occur, nervousness, insomnia will occur. So all these are the side effects of theophylline overdose. Thank you for watching.
Thank you and thank you for watching.